Correct.
Hi, I'm Ashley. I'm a nurse practitioner. I'm going to be just doing an assessment. We're going to go over your hair, skin, and nails, and then we're going to follow, kind of start from the top and go through your head, your neck, including your eyes, ears, nose, and mouth. Sound good?
Mm-hmm.
Good, perfect. So first we're going to start just looking at your hair here. It appears generally clean, healthy in nature. I'm just going to take this. I'm going to ask if you could take that hair tie out for me if you don't mind. Sorry there.
That's good.
You do have quite a bit of hair here.
Oh,
I'm just going to palpate your scalp here. Do you have any pain or tenderness anywhere?
No.
I'm just going to start to look and make sure there's no redness, any open skin, make sure everything's intact all throughout. The texture is generally the same throughout, shows that you're well hydrated, everything appears clean in nature in that point. Then we're going to move on and just kind of look at your skin. Generally appears the same in color throughout. The temperature is warm to touch, both sides, warm and dry. We're just going to look for any lesions. I'm going to start looking up here. If you want to turn your head away.
Mm-hmm.
Perfect. We're going to look around this way. Look towards me. Just some freckles. We're going to check skin charger here. I'm just going to pinch right below your collarbone.
Okay.
Perfect. You have no tenting. Just shows like a hydration status. As you get older, your skin tends to get thinner and it'll like kind of tent up and take some while to return back to its normal. So it checks your elasticity.
Mm-hmm.
We're going to keep going down. Everything appears normal here. Take a look at this side as well. Good. We're going to move on to your nails. We're just going to look at the size, shape, color. I'm going to press down here.
Mm-hmm.
Just check capillary refill. Make sure you have good blood flow coming throughout. Texture is good there as well. We're going to move down to the legs. About the same thing. Give the same warmth throughout. Same with your toes here. We're assessing the shape, texture, any bumps, ridges, or anything like that.
Mm-hmm.
Good. Do you have any other skin issues that you've had in the past? Any changes you've noticed thus far?
No.
No, everything's been the same?
Mm-hmm.
Perfect. Now I think we're going to start with your head. Just like kind of go from there.
Okay.
So I am going to palpate your scalp once more. Just feel like the structure. Any pain
No.
when I push?
No.
I'm going to just feel your temporal arteries here.
Mm-hmm.
Good. Feel your jaw. You want to open your mouth? Good.
Mm-hmm.
Close. Perfect. Now I'm going to just assess your lymph nodes here. We're going to start with your one in the back. Circular. Just feeling for anything enlarged. If you have any pain or anything as I go through, please let me know. You want to turn your head towards me? Good. Turn it back.
Mm-hmm.
Any pain or anything throughout?
No, it's fine.
Perfect. We're also going to take a look here. Have you had any sinus pressure lately?
No.
Just a little pressure here. Anything, any pain or tenderness when I do this?
No.
No? Okay. Now I'm going to move on to like your eye exam. So I just want you to look straight ahead at me.
Mm-hmm.
Perfect. I want you to look up. Just going to take a look at the color. Good. There you are. Okay. Now I'm just going to have you look straight ahead at this pen light here.
Mm-hmm.
I just want you to follow the pen with your eyes, okay?
Mm-hmm.
Good. Now I am going to step a little bit closer to you. I'm just going to check your peripheral vision.
Mm-hmm.
I'm going to stick my hands behind you, and then when you start to see them, I want you to let me know, okay?
Let's see.
Perfect.
Yep.
Mm-hmm. And one more.
Yes.
Perfect. Now I'm going to take this light again, and I am going to shine it in your eyes. I want you to look straight ahead towards me.
Mm-hmm.
Perfect. And this one as well. Good. And then you do not wear contacts or glasses, correct?
I do not.
Perfect. Okay. So I am going to take this eye chart here. I'm going to stand approximately 6 feet away. I'm going to hold it up. Can you read the smallest line you can for me?
CFDHJ.
Perfect. And then can you read the one above it?
EPTZO.
Perfect. And then one below?
LTFFH.
Perfect. Can you cover your left eye? And I want you to read this line right here.
The very bottom one or the one above it?
The smallest one you could read.
Okay. LTFPH.
Perfect. And you can cover the other eye. Switch.
Mm-hmm.
Perfect. One more time. The lowest one you can read.
Okay. CFDHJ.
Perfect. Okay. I'm just going to take a look with your eye here. Put this down to 0. Now I'm going to take a look into your right eye, okay? Just look straight ahead. I am going to get in closer. Perfect.
It's okay.
I'm going to come over to this side. Take a look at your left eye. Go straight ahead. Very good. Perfect. Okay. Next, we are going to take a look at your ears. Switch up a couple of things here. Okay. First, I'm just going to take a look. Move this hair out of the way. Just take a look, make sure they're symmetrical here, everything there. I'm going to palpate the outside. Do you have any pain or tenderness or anything here?
No.
We're going to do a tug test here. Any pain?
No.
No? Perfect. I'm going to ask you to occlude one of your ears. The other side, you can just kind of put your finger in your ear. And I'm going to whisper a word. I want you to say it back to me, okay?
Okay. Apple.
Okay. Do the other ear.
Baseball.
Perfect. Okay. I'm going to have you look this way here. You want to scooch a little bit, or up a little bit, just so I can get closer to you here. Just going to pull your ear up and back. Just going to take a look. Okay, the other side. Perfect. And then at this point, I would typically use a tuning fork just to test your auditory function. We would hold it behind your ear until the sound dissipates, and then in front of your ear as well from that point on. Next, we're going to just look at your nose. Any issues, any pain or anything? Palpate here. Want to look up? Tilt your head back just a little bit. Yep. Just going to look. Perfect. Looking for any septal deviation, the mucosal lining, anything like that. Very good. All right. Next, I'm just going to have you open up your mouth. Stick out your tongue. Say ah. Perfect. I'm just looking at the inner linings of your mouth, your dentition, your uvula, tonsils, everything like that. At this point, I would typically palpate the inside of your cheek just to make sure everything feels appropriate. Next, we're going to inspect your neck here. Just going to move your hair out of the way. Just going to feel your trachea here. Any pain or tenderness?
No.
Okay, I'm going to have you kind of tilt to the side a little bit. We're just going to assess your thyroid gland. It might be a little uncomfortable, but it shouldn't hurt. Have both hands on both sides. Okay, you want to swallow? Perfect. Otherwise, I think that kind of concludes my assessment for today. Do you have any questions or any other concerns?
No, I'm fine.
Perfect. Thank you so much.